Minister Aaron Motsoaledi says the man being treated at a hospital in Potchefstroom in the northwest has tested negative for Ebola. Well, this follows media speculation about why the man had been placed in isolation. The minister was speaking at a media briefing earlier on the Ebola Response Fund. Well, Dr. Ramnik Aluwalia is the Director of Higher Education and Training HIV/AIDS Program at the Department of Health, and he's on the line now. Good afternoon, Dr. Aluwalia, and thank you for your time on the PM News Desk.
Thank you, Kirshni. Thank you very much.
Look, the Health Minister, he has indeed been very thorough, very accurate, tenacious in tackling this killer virus. But a need now for the media to report responsibly on the matter crucial here.
I think absolutely. I think the Minister's been spot on. There has been the distance between Western Africa and Southern Africa is far. There's a less of communication going around in between the commuters, that is the travelers. Yes, the important thing is that we have to be vigilant with Ebola. We are very vigilant with Ebola. It's a very deadly virus. It spreads through. It's in fact very truly it can be another HIV/AIDS epidemic if not looked into severely now. And that's where the real problem is. So I think,
Doctor,
first of all, the myth has to be taken out that Ebola is in South Africa. First of all, Ebola is not in South Africa.
Doctor, how vulnerable are we in light of the high numbers of HIV and TB sufferers we have already in the country with lowered level of immunity right now?
And definitely, I think that's the most scariest part for South Africa at this moment. We already are battling with two major diseases in the world, which are highest concentrations depends on us. That is HIV, and we are the third highest in TB. Now, what happens is that HIV lowers your immunity. And immunity is very important, even if you contract Ebola, is because your immune system is what that helps you fight the disease. And I think once you already have a lowered immunity, any other virus will immediately grapple you to get a more devastating effect. So I think, yes, South Africa or Southern Africa in reality has to be more vigilant, much more in risk because of the dual epidemic we're already suffering. And I think another Ebola will create an enormous disaster to this country.
Doctor, how ready are we if this killer virus should come our way?
I think what we need to do is we need to provide enormous education, and I'm repealing through mass media, that is your channels and the other community radio channels around South Africa, is to educate people. I think what we need in this country, and importantly, is education. If we transform the knowledge about Ebola clearly to everyone, we can prevent any disease in the world, not only in South Africa but in the world. And I think simple things like careful hygiene. If you report a fever, report it immediately. If somebody has traveled from West Africa and they have had an exposure with anybody in the South Africa and you have had fever, report it immediately. Even the others should report it immediately, because I think reporting quarantine early will prevent this disease from spreading in South Africa. And I think care is very important at this moment.
Thank you, Doctor. That's the Department of Health, Dr. Ramnik Aluwalia, on the line to us from Pretoria. Moving on to other news now, Metro Rail has appealed to government to hand down stringent sentences for cable thieves. The rail agency is holding an exhibition at the